Crowds were back at Aintree today. It's easy to forget COVID hasn't gone away, but for the vulnerable, it certainly hasn't. And this is the drug that the NHS believes could help us all leave the pandemic behind. Paxlovid, a new antiviral that's sent out to the highest risk patients if they catch COVID. When that happened to Kathy, she became one of the first in the country to receive them.
Seeing that positive test immediately made me feel rather angry because we realised that after all of being so careful, it still had managed to contract COVID.
But she phoned her doctors, who prescribed her the new antiviral.
They put them in a taxi and sent them to me. So basically within 24 hours of having a positive lateral flow test and feeling unwell, I had the drugs.
The treatment aims to stop COVID replicating. Pfizer, the drug company that makes it, said their trial showed it cut hospitalisation or death by 88% in high-risk adults.
But some are questioning whether it works quite that well and whether it's worth the vast sums of money that have been spent. The trial was done in people who hadn't been vaccinated, and it's claimed we simply don't know how much it reduces the risk of hospitalisation in people who have had the jabs.
Some experts say it's unclear what value it brings.
These drugs were tested in 2021, where there were much more serious variants of COVID around, and a lot of people were not vaccinated. The trials only looked at unvaccinated people. In Britain now, the vast majority of at-risk people have been vaccinated.
NHS leaders say they're always learning.
Just 2 years into the pandemic, not only do we have highly effective vaccines, but we've got highly effective drugs. That's a remarkable achievement by the scientific and clinical community. But of course, we still need to know more. We still need to do more clinical trials.
Kathy will never know the difference Paxlovid made to the course of her illness, but she will now be part of real-world evidence, helping us to understand how to protect the most vulnerable from the virus. Deborah Cohen, News at 10.